This is Facebook Live with Tony, and I'm grateful to have as my guest Dr. Robert Feldman, who's Acting Director of Emergency Management for our Cook County Health. Dr. Feldman, why don't you tell us a little bit about yourself, how you got to be a doctor, and how you got to this position?
Thank you so much for having me. I was born in Cook County in Evanston, and
Not at the hospital.
at Evanston Hospital.
Evanston Hospital, okay.
Evanston Hospital, way back when. My father was and still is a physician there, so I was always exposed to the
This is a
practice
family
of
business.
medicine. It is to an extent the family business. I spent a lot of time as a kid working in various capacities and volunteering at Evanston Hospital, patient transporter, worked in the office, worked with the computer systems there, worked in research, and just really loved medicine and could never really see myself doing anything else. In college, I went to Northwestern, stayed in Evanston, and studied biomedical engineering, which I found really interesting and challenging. But when it came right down to it, I really loved patient care. I had, in college, had trained as an emergency medical technician, had taught as an EMT instructor, and had worked on one of the private ambulances in Chicago, and just really found that I loved taking care of patients in doing that. So when the time came, I went out to California, figured I needed a little time away, and went to University of California, San Francisco for medical school, really found that I loved working in the county hospitals, San Francisco General, Highland Hospital in Oakland, California. I worked in Fresno at the county hospital there, Salinas, California. Really loved county hospitals.
What drew you to public hospitals?
I love the emphasis on the patients. I love taking care of the patients. I love the diversity of the patients, and just how much of a difference we get to make. I've worked in private places too, and that's very gratifying. I think everyone is equally deserving of care. But particularly in my chosen specialty, emergency medicine, what we're able to do for people in the county where people don't necessarily have access to care, there's just such an opportunity to make a difference. And I think when I talk to my colleagues who work at county, all the county hospitals, if you say, why do you work here? That's the biggest answer everyone gives, is it's a chance to make a difference.
So what is emergency medicine?
Emergency medicine is really it's really sort of detective work. Someone comes in who you've never met, and in just a short amount of time, we have to figure out, is what they have a life-threatening emergency? We have to figure out what tests we need to do, if any, to manage it. If someone comes in immediately dying, having a heart attack, we get to manage that. A lot of that is, there are protocols so that in that critical moment, there's not a danger of freezing up. We know you do this, this, this. But then for the patients, which is most of them who aren't dying right that second, we really get to talk to the patient, examine them, really make the diagnosis. We do a lot of figuring out what's going on, making the initial diagnosis, and then we make what we call a disposition. Is this someone who has to stay in the hospital? Is it someone who can go home? And we have to do that many times over the course of a shift. So it's very interesting and very challenging because we have no control over what walks in the door. It could be anything, as opposed to some other specialties of medicine where you have a pretty good idea what's coming to see you. If you're a surgeon, someone might be sent to you because they have a problem, they need the gallbladder taken out. You know that. For us, Someone can walk in, it could be the gallbladder, it could be a heart attack, it could be a panic attack. We just don't know, and having to figure that out over and over again over the course of a shift is just a wonderful challenge, rather than, say,
So it's
in an open emergency
very high-level
department
problem
where the
solving.
beds are just separated by curtains. It is problem solving, to decrease the density is some of where it connects with me with my interest in engineering, which is
All right, now
also
the challenge,
really
as I understand it, now
problem-solving.
I go to our emergency operations
I
center
guess a
every
lot of people
Monday,
come into
to
to
medicine,
thank the
having
good
studied
folks for all the work they
chemistry
do.
or biology or
Walking
whatever.
in,
But
they
what was about the
point this little
engineering
thing at my
that-
head and take my
that's
temperature.
motivated
Okay.
you? I presume that's how you're
Really
screening
that-
people.
Engineering
We are
is
checking,
defining a problem.
patients' temperatures.
There's something there. You
We'll use a
look at
combination
the
of infrared
problem.
thermometers.
We
and
develop
also,
a model
oral
in our
thermometers,
minds
being careful
of what that
that,
problem is.
people keep their
And
masks
then
on
we
as much
come
as
up with a
possible,
solution
and
to
staff
that
are always
problem.
wearing
And then
protective
we'll
equipment. So
model
everyone-
whether that
every
solution
patient comes in,
works.
gets their temperature
Which to
checked.
me is very
We would
similar
normally be
to
doing that anyway, but we
what a
make sure
physician
it's done
does,
very early
where a
in the
patient
process.
comes in.
Right.
We think about
Um,
the anatomy
now,
of how
the
the body's
challenge I
put
see,
together,
and
the
this is a
physiology of how it
layperson
works.
speaking.
Think about
Clearly, a lot of people who have
things that could
the
be causing the
disease are
patient's symptoms,
asymptomatic,
what
so
they're
even if you don't
having.
have a
Say they've
fever,
got pain
you
in the
might
belly here.
have it. So how
And
are you
then
dealing with that challenge?
When we think about that, then we can do
We
tests to
are
try to confirm
following
that. And then we
universal
come up with a solution
protective equipment precautions.
and do that.
Just
So
as
it's
here
really
in
that
your office or
process
at the county
of
building,
defining and then trying to solve
we
a
are all
problem.
wearing masks.
Or
all
when
the
there's
time,
many
except
solutions, which
for,
there often are in
you know,
engineering
during
or
those rare
medicine, it's
times
trying
when
to
we're
pick
careful to be
which one
separated
is the
from each
best
other
one,
when we
which
might need to
one's
eat or drink.
the safest, the best chance of curing the
or have
patient,
a
and then
sip of
also
water.
the most cost-effective as
We
well. So we
are,
really integrate all of those things.
Practicing good hand
So the
hygiene,
sort of
which is
problem-solving
really
part of
incredibly
engineering
important
has a lot
during
of
this,
synergy with your emergency
because
medicine
a
work.
lot
I find
of
that
the
it does.
infections probably
Okay.
were caused
So you're
by
head of the
people
emergency
touching
management
something
committee.
someone
What does
else
that
had
mean?
touched, and then touching.
So every
These just
hospital
touching
has to have.
Minuscule isn't quite the right
an
word, whatever,
emergency
teeny
management
tiny
committee.
particles.
And
They pick them up and then they touch
what
their
the
face or
committees
something.
do
right. So
is,
wearing the masks, wearing eye protection.
keep track of how
those we think
we're
are probably
prepared
the most
to respond to
important
emergencies.
things,
So it'll be things
to
like, for
prevent it, and
example,
we are doing
making
that for
sure that
everyone
we have
all of the
several
time.
days of
So
food,
even if
water, making sure that we
someone
have
has
adequate
it
supplies
and is
of
not
personal
symptomatic,
protective equipment,
we're
hospital
treating
beds, certain
essentially
medications
everyone
that
as
are
if
needed to
they could
treat
have it. And then the people
things
who
like a bioterrorist attack.
are more
We review
symptomatic,
those, and then we also
sicker,
develop what's called an
coughing,
emergency
might be more
operations
likely to be
plan.
spreading it.
And every
We're
hospital,
taking
every
even additional
organization, really,
precautions.
just like the
But
county
all of our
does,
patients,
has
for
to have an
example, who come
emergency
in,
operations
they are all wearing
plan
masks as well.
that
Throughout their
analyzes what our
stays, unless
biggest
they have an
threats are
oxygen
that we
mask
might
on,
face,
and
the
even
biggest
then,
hazards.
We'll often put a mask
For us, the
over it
pandemic was
to,
one of the
make
ones
sure
that
we're
we
filtering whatever the
had
patient's
picked
breathing out.
as
And
one
I
of
presume you're
our
providing
biggest
masks to people
hazards.
who don't come with
And
them.
then we come
We are
up with
providing
ways to
masks.
try to
Okay.
mitigate,
Thousands
decrease
and
the
thousands of them
consequences of those
to
hazards.
everyone who needs
And then
Right.
to be
Now
able
tell me,
to manage
so
them
that's
and
the sort
recover from them.
of portal, entry
We
into the
meet
emergency room.
regularly
So what
through the
happens
year
how has it
and,
impacted the actual
develop and
operations
refine those
inside the
plans.
emergency?
And then we also
In the emergency department, we
try to ensure
split
that,
up
that everyone in the organization
teams.
knows about
We
the parts of
we'll
the
have
plans and
providers
how
who
they
are
respond
assigned
in an
to
emergency.
work in those areas.
I'm going to give you a chance to
where
get a
we're
drink
putting
of
the
water
patients who are
here,
most
since you're
likely to
coughing a
have
little bit.
COVID.
I know
Those
that
people
in a
are,
pandemic, clearly our
be wearing,
emergency staff is on the front line. Speaking of
additional,
not knowing what comes in the door, you
protective
definitely don't
equipment
know whether
usually
the person who
throughout their
comes in the
shift,
door has
just because they're
COVID-19 or
having
not,
more
right? And
interactions.
they're now identified a
and
broad range of
We are
symptoms.
we are working
So
very
it's
hard
not
to make a
simply
diagnosis
coughing
on those
and
folks, get
shortness
them
of
tested
breath
as
or
quickly as
whatever, but all
possible,
kinds of other
and
things,
for those who
including
need to
purple
be
toes or
admitted,
something, right?
to get them upstairs
so
as quickly as possible to
How has
decrease
the
density of
pandemic
patients in the
impacted how you
emergency
do your
department.
work? What goes on in the emergency room? I understand that you've recently visited the jail. The jail is our
really
pain
changed
point
everything throughout
in terms
medicine.
of the
In
county.
emergency department,
It's very hard to do social
what I
distancing
think
in a
most
jail.
ERs, including ours,
What
have
can you
tried
tell
to
us about
do
what's going on there?
is to have an initial
the first thing
area
I'll say is I
where
was
we
there a
very
few weeks ago.
rapidly assess the patient.
It was very
and
surprising.
Find out if they have a
If it's
fever,
not,
if they have any of the
as
other
their,
signs or symptoms of
their
COVID.
excellent COO,
Have
there,
they
Rob
had
Feldman, said
a
after
cough,
at the end of the visit, I was there with a team from
fevers,
CDC and the
weakness,
health department.
CDC being the
if
Centers for
patient
Disease
has
Control.
things that
But federal-
could
federal-
potentially be
right.
COVID, we put them in one part of the
It's
ER
not
where
what
we've split off the
I
patients
or
who
I
are
think most
likely to
people
have
expect.
COVID.
It really
If they screen and they're negative,
is-
then they
At
go
this
to
point seems to be
a different
under
part of
very
the
good
ER.
control.
So
They
we've
very
really tried
carefully,
to split
once
the emergency
outbreak-
department to have those two
became
separate
evident, and this
streams,
was all
both
something
to
new for
minimize
all of us,
potential
realizing
exposures
how
to
it
the
spreads,
staff
how
and of
fast it
course
spreads, and
patients
of
to
course,
other patients
as you
who might have
mentioned,
it.
Tony,
We've also had
asymptomatic
to
spread, where people can spread it and not know they're sick.
change
You
some
can
of the
imagine
flow
that
in our
any
emergency department to
congregate
try to
place where
maximize
people are living
patients
closely
being in
together,
private
whether a
rooms
nursing home,
rather than say
a jail,
in an open
college
emergency
dormitory,
department
any
where
place
the
a
beds are
battleship.
just separated
Yes,
by curtains.
exactly.
We try to decrease the
Aircraft
density
carriers.
of
It can
patients
spread
in the
so
emergency
rapidly,
department.
and by the time
All right, now
people
the
start getting
challenge,
sick,
as I
it's already
understand it, now
spread
I
for
go
a
to our
couple of
Emergency
weeks.
Operations
That
Center
was a
every
big
Monday
challenge. I think they were able
to
to do
thank
an
the good
incredible
folks for all the
job
work they do.
investigating
walking in,
that.
they
We have
point this
excellent
little thing at
infection
my head
control
and take my temperature,
practitioners,
okay?
uh,
I
for
presume
our
that's how
health
you're
system.
screening people.
And they were able
We
to
are
separate
checking
out
patients'
and test
temperatures.
patients who
We definitely
will use a
had
combination
COVID,
of
tested
infrared
positive.
thermometers and
For the people who
also
were recovering,
oral
they were
thermometers, being
able
careful
to
that,
reopen
people keep their
the
masks
old
on as much
sheriff's
as
boot
possible.
camp
And staff are always wearing protective
facility,
equipment.
which
So everyone, every patient who comes in
is
gets their temperature
essentially
checked.
dormitories.
We would normally be doing that anyway,
for
but we make sure it's done
detainees who
very
are
early in the
eligible,
process.
Right.
Who weren't
Now, the challenge I
charged
see,
with violent
and this
crimes,
is a
for example, who
layperson
could safely
speaking.
be housed there.
Clearly, a
in the
lot of
setting
people who
where
have
people
the
could,
disease are asymptomatic,
be
so even if you don't
separated
have
from
a
the other
fever, you
detainees.
might
And
have
then
it. So
the
how
remaining
are you dealing with that
detainees,
challenge?
They decreased the
We are
housing density
following
there tremendously.
universal
So Cook County Jail, I believe at its height,
precautions,
had
such
over
as
10,000
here
people
in your
in
office
detention.
or at the county
Right
building.
now, I think
we are all
due to
wearing
decreases in
masks,
people coming in
all the time,
and
except
also
for,
efforts during those
try
rare
to
times when we're
release,
careful to be
in whatever
separated
way
as
from
many
each
people as
other when we
possible
might
on the
need
part of
to
the
eat or
courts.
drink.
You have
or
4,000
have a
detainees,
sip of water,
but they're spread over the
we
space that you would normally have
are,
9 or 10,000. By
practicing
decreasing that
good
density
hand hygiene,
what they're able
which
to
is
do
really
then
incredibly
is decrease
important
opportunities for transmission.
during this.
They're also
testing
because a
everyone
lot
new
of
who's
the
been coming in
infections
for the past
probably
couple of
were
weeks
caused by
to
people
keep
touching
anyone
something
who's
someone else had
asymptomatic
touched
from
and
reintroducing
then
it.
touching into
These
the
just
jail. Touching them, but it's really quite
minuscule
it's
isn't quite the right word, whatever
amazing
teeny
there.
tiny
It's not,
particles.
yes,
They pick
what
them
I
up and then they touch their
expected
face
after
or
just a little
something.
bit. Right. So wearing the
protests on
masks,
TV
wearing
and other
eye
stuff,
protection,
it really is
those
a
we think are
tremendous
probably
operation.
the most
And I think
important
the
things,
Centers for Disease Control
to
people
prevent
were,
it, and we are doing that for
appropriately
everyone.
impressed as well
all of
what
the
they
time.
managed to achieve
So
there.
even if
to really
someone
has
get
it
it under
and
control
is
not symptomatic.
So we've kind of covered a
we're
broad
treating
spectrum here. Are there any
essentially
final
everyone as
thoughts you
if
want to
they
share with
could
us?
have it. And then the people who
I think the
are
biggest thing
more
is just-
symptomatic, sicker,
I had a lot of concerns
coughing,
going
might be
into
more
this,
likely
seeing
to
it
be
coming.
spreading it. We're
We
taking
had a
even
health
additional
system that,
precautions with, but
you know,
all of our
it's a
patients, for
public
example,
health
who come
system.
in,
There's always
they are all
financial
wearing
pressures
masks
as well.
We had just had a
Throughout
big
their-
change
their
in
leadership,
leadership,
we
days
have a
unless
lot
they
of
have an
interim,
oxygen mask on.
this
even
and that.
interim
We'll
CEO
often
interim
put a mask
everything, and I
over
was
it
very concerned
to make
about
sure we're
how we would
filtering
be able
whatever
to
the patient's
respond.
breathing out.
And I presume
will
you're providing
honestly
masks to
say
people who don't come with them.
that it
We
has
are providing
been just such a
masks.
privilege
Thousands
and
and
pleasure
thousands
to
of
be
them
involved
to
with
everyone who needs them.
Right.
From
Now tell
the
me,
County
so
Emergency
that's the sort
Management
of
Agency, which has been a
portal,
tremendous
entry into
support.
the emergency room. So what happens
The
when
Chicago
how is
Healthcare
it impacting
Coalition,
the actual
Chicago
operations
Department of Public
inside
Health,
the
Cook County
emergency?
Department of Public Health, in the emergency
The,
department,
executive
we've
team and
split up,
everyone,
from
teams,
all
we
different
have,
levels.
we'll
at
have
Cook County
providers
Health.
who are
I think
assigned
people have
to
just
work
stepped
in those
up
areas
tremendously.
we're putting the patients
even
who are most
early
likely
on,
to have
we
COVID.
were really frightened. We didn't know
Those
how it was
people
spreading, how bad it would
are,
get.
you know,
And I
we
think
wearing,
people have really
tremendously been able to
additional
step up and
protective
while none
equipment
of us
usually
would
throughout
want
their
something
shift,
like this horrible pandemic
just because they're having
happen.
more interactions.
It has been such a
we
privilege
are
to be
able to
trying,
be part
we're
of it
working
and
very
respond
hard
to
to
it,
make
to
a
be doing
diagnosis
what we
on those
can,
folks, get them tested as quickly
as a
as
health
possible,
system,
and
to
for those who need to
really
be admitted,
respond to this,
which
to
is
get
really
them upstairs as
an
quickly as
unprecedented
possible
thing
to
that has not
decrease the
happened
density
in
of
any of
patients in
our
the emergency
lifetimes.
department. And hopefully it won't happen again.
I understand that you've
our
recently visited
lifetimes.
the jail. The
So
jail is our
that's really the
defining,
biggest
a
thing.
defining period in our, in terms of the
It's a
county.
defining period and just,
It's very hard to do
I
social
think things
distancing
like
in a
this will just
jail.
split people apart
What
or
can you
bring
tell
them
us about what's
together.
going on there?
And I think it really
The first thing I'll
has
say
brought
is
us
I was
together,
there
and
a
I'm
few
very
weeks
proud
ago.
of what everyone has
It
been
was
able
very
to accomplish
surprising.
at whatever level
It's
all not,
And it's been a pleasure to work
as
with all
their,
our agencies as
their
well.
excellent COO.
Thank you.
there,
Thank you very
Lynn
much, Dr.
Fullwiler, said
Feldman. I want to
after-
thank
at
you
the end of
personally
the-
for your
the
good
visit, I
work, and
was
please
there with a
convey my
team from
thanks to all the
CDC
people
and
on
the
your
health
team.
department. I will, thank you so much
CDC
for
being the
having
Centers
me.
for Disease
Thank you for
Control.
everything you've
The
been
federal-
doing. Chicago
federal-
for this as well.
Right, thank you. Thank you for joining us.
It's not what I think most people expect. It really, great, thank you so much. Sorry
Okay.
about the the hay fever. At this point, seems to be under very good control. They very carefully, once the outbreak became evident, and this is all something new for all of us, realizing how it spreads, how fast it spreads, and of course, as you mentioned, Tony, the asymptomatic spread, where people can spread it and not know they're sick. You can imagine that in any congregate place where people are living closely together, whether a nursing home, a jail, a college dormitory, any places like that.
A battleship?
Yes, exactly. Aircraft carriers, it can spread so rapidly. And by the time people start getting sick, it's already spread for a couple of weeks. That was a big challenge. I think they were able to do an incredible job investigating that. We have excellent infection control practitioners for our health system, and they were able to separate out and test the patients who definitely had COVID, who tested positive. For the people who were recovering, they were able to reopen the old Sheriff's Boot Camp facility, which is essentially dormitories for detainees who are eligible, who weren't charged with violent crimes, for example, who could safely be housed there in a setting where people could be separated from the other detainees. And then the remaining detainees, they decreased the housing density there tremendously. So Cook County Jail, I believe at its height, had over 10,000 people in detention. Right now, I think due to decreases in people coming in and also efforts to try to release in whatever way as many people as possible on the part of the courts, you have about 4,000 detainees, but they're spread over the space that you would normally have 9,000 or 10,000. By decreasing that density, what they're able to do then is decrease opportunities for transmission. They're also testing everyone new who's been coming in for the past couple of weeks to keep anyone who's asymptomatic from reintroducing it into the jail. But it's really quite amazing there. It's not what I expected after seeing protests on TV and other stuff. It really is a tremendous operation. And I think the Centers for Disease Control people were appropriately impressed as well with what they've managed to achieve there to really get it under control.
So we've kind of covered a broad spectrum here. Are there any final thoughts you want to share with us?
I think that the biggest thing is just, I had a lot of concerns going into this, seeing it coming. We had a health system that, it's a public health system. There's always financial pressures. We had just had a big change in leadership. We have a lot of interim this and that, interim CEO, interim everything. And I was very concerned about how we would be able to respond. I will honestly say that it has been just such a privilege and a pleasure to be involved with everyone, from the County Emergency Management Agency, which has been a tremendous support, the Chicago Healthcare Coalition, the Chicago Department of Public Health, Cook County Department of Public Health, the executive team, and everyone from all different levels at Cook County Health. I think people have just stepped up tremendously. Even early on, when we were really frightened, we didn't know how it was spreading, how bad it would get. And I think people have really tremendously been able to step up. And while none of us would want something like this horrible pandemic to happen, it has been such a privilege to be able to be part of it and respond to it, and to be doing what we can as a health system to really respond to this, which is really an unprecedented thing that has not happened in any of our lifetimes, and hopefully won't happen again in our lifetimes. So that's really the biggest thing.
A defining period in our...
It's a defining period, and just, I think things like this will either split people apart or bring them together. And I think it really has brought us together, and I'm very proud of what everyone has been able to accomplish at whatever level, and and it's been a pleasure to work with our partner agencies as well.
Thank you. Thank you very much, Dr. Feldman. I want to thank you personally for your good work, and please convey my thanks to all the people on your team.
I will. Thank you so much for having me, and thank you for everything you've been doing for this as well.
Thank you. Thank you for joining us.